session on the Intimate Matters Podcast YouTube page. And the Intimate Matters Podcast is a podcast that takes you on a deep dive into the world of sexual and reproductive health. Here we talk about everything sexual and reproductive health, from the physiological to the psychological. We talk about even the policies. We talked about how culture, how traditions, how people's spiritual, religious beliefs affect the intimate matters being your sexual and reproductive health. My name is Nosakwa Wokpan, and I am your anchor on this podcast. And we've been glad that we've been able to have over 20 episodes on this podcast talking across various issues: pregnancy, miscarriages, reducing compatibility, HIV, and kings and fetishes, sexual and reproductive health rights, and so many other things. So do well to check out our channels and to follow us on all social media platforms. You can engage with us on our TikTok platform. It's still Intimate Matters. You can Intimate Matters Podcast. You can check us out on our Instagram, on our Facebook. And if you check the description here, you'll find a link to our WhatsApp channel where you can follow us and we can get to interact proper. And as always, every week we find time, to discuss the chat with you as it pertains to issues, give an idea about issues that are happening in the world of sexual and reproductive, and sometimes conditions or things that our followers, our fans have asked us to speak about. And today, we want to talk about male factor infertility. Male factor infertility. So, to put it in a simpler term, it's just simply the factors that are contributed by men as it comes to infertility. I think we've spoken about, we even have a podcast episode on infertility. So you can go back and look at infertility as a whole. It's almost an hour-long podcast episode where we talk about infertility, the causes of infertility, what you can do if you're infertile, or if you know somebody that is infertile, and possible prognosis as the case is. But today we want to look at the aspect as it pertains to men, male factor in infertility. So what do men do? Now, this is coming as a burden. This came as a burden over the week. I think last week I attended a fertility summit, and it were in my town, and I noticed that 90% of the participants were women. And a woman even had to stand up to advocate that this kind of education should be taken to where men are, because men also do contribute. So statistically, we look at the fact that men and women share equal proportion in terms of contributory factors. Let me put it down. I don't want to call it blend. So most times, same, they contribute the same level when it comes to infertility. But then the brunt of the issue is often on the women. So that is what we want to, talk about. So let's look at male factor infertility. When we're talking about male factor infertility or male factor in infertility, we're talking about the fact that these are how men can contribute to infertility. What are the things that you do, or you can do, or you have done, or can do later that may become an issue to fertility? So don't forget that it takes two to tango. So it takes an egg and a sperm to make a baby. The man contributes the sperm, the woman contributes the egg, and the woman carries the baby. So that part that you contribute, being the sperm, is very, 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 very important. It's essential that we know that. So it's not, infertility is not always a woman's problem. It doesn't always mean that it's a woman that is at fault when it comes to infertility. I think we should really, really, really point that out. It's essential that that is pointed out and for us to know. So, what are these possible things that could be possible things that could be male factor infertility? So, the possible things that could happen and could be male factor infertility ranges. So, male factor infertility has to be when a man can seem to be infertile when he cannot get a woman pregnant, or he had already gotten a woman pregnant but can no longer do so. So for people who are less than 35, we're looking at trying for like 1 year, consistently trying to get a woman pregnant for like 1 year. That has to say that you're having consistent unprotected sexual intercourse for about a year. And if you're not, that's when you're pregnant. Then if it's over 35, we're looking at 6 months. And we have both primary and secondary infertility that affects a man and a man and even a woman, but in this context, a man. So primary infertility is when you've never been able to get a woman pregnant. But then the secondary infertility is, it has happened before. You've been able to get a woman pregnant, but currently at the moment you try but unable to. So what could be the possible causes? Like I said, the main thing a man contributes in fertility or pregnancy is the sperm. So first comes the problem with the sperm. First is the problem with the sperm. So there are different problems that could happen with the sperm. It could be issue with morphology, that it could be issue with the quantity and the quality of the sperm. So quantity, if you don't have the right quantity, so what we call low sperm count, it could be issue with quality, like the morphology. We could have um low sperm motility, that's asthenospermia, or abnormal sperm shape like teratospermia. So a sperm is supposed to have a head, a tail, a head, a body, and a tail, but sometimes there are two heads, two tails, three tails. All of those issues are problem, are causes of male factor infertility. Causes of male factor infertility. There's also genetic problems. So genetic problems could be on the sperm itself or could be on the man. So these are chromosomal abnormalities that affect either sperm production or function. So any abnormality that will affect the production of sperm or maybe the possible functioning of the sperm could impede on your ability of a man to or a male to impregnate a lady. Yes, so genetic mutation. Then there's hormonal imbalances. So just like a woman, there are certain hormones that are peculiar to a man: follicle stimulating hormones, luteinizing hormones, testosterone. Don't forget that testosterone is very essential in the production of sperm and even in the whole sexual process, libido, sexual urges. So if if there are these imbalances in hormones, it can become a problem. Infection is also another possible cause. Infection. So most time when we say infection, it's often the focus is often on the woman, but then a man can also get infected and it can impede on our fertility. So this infection can affect your reproductive tract, leading to inflammation. So what will the inflammation do? It will cause damage to the sperm when the sperm is trying to pass, or even block the sperm from passing. So let's say you have an untreated sexually transmitted infection and you did not treat it properly, or you even failed to treat it. It leads to adhesion in the urethra. So the urethra is where urine and sperm passes. So when there's that adhesion, it means there's a blockage. It can't pass as it should. So that's a problem. Now coming down there, which I already mentioned, structural problems could also be another cause. There are so many tubes that contribute in one way. Either they transport the sperm or they transport the other fluids that combine together with the sperm to make the semen. So if there are blockages in these places, like for example, if there's blockages in the vas deferens is the tube that transports the sperm. So if there's a blockage there, that means there will be a fertility problem. Or other structural abnormality, there's a blockage, maybe there's a structural abnormalities to the testes. The testis is not the right size, it's not, maybe the testes has gone back into their body instead of hanging outside in the scrotum. All this could be a problem. Then there's environmental and lifestyle factors. Smoking, excessive alcohol consumption, medication, certain forms of medication, exposure to toxins, especially people working around chemical, obesity. All these can negatively impact sperm quality, either directly or indirectly by affecting the hormones or affecting the homeostasis of the body. It's essential that you're careful of the kind of chemical you get into yourself, whether knowingly or unknowingly. Knowingly, like in the cause of consumption of alcohol or chemicals or consumption of, or maybe smoking, unknowingly, like exposure to chemicals, maybe in the workplace or in the environment. It's essential. The last but not the least factor that we'll mention here is medical conditions. There are certain conditions that directly or indirectly impact on the reproductive system. So it could be illnesses, it could be injuries. So you have an accident, for example, a road traffic accident, for example, and there's trauma to the testes. That means it will affect sperm production. Or maybe there's a chronic health condition, maybe like cancer, and you have to undergo treatment. I talked about medication. So some of these drugs that are used for this treatment may come to impact on male fertility. So it's essential that that is taken care of. So diagnosis, how do we diagnose male factor infertility? So there's semen analysis where a sample of semen is taken and analyzed, like I talked about. So to check maybe for sperm counts, for motility, for morphology, that's to check the quantity and the quality of sperm if it's as it should be. Then there's also hormone testing to help with hormonal imbalances. physical examination, especially the testicles and maybe areas of the genitals to see if there's any abnormality. Then we have imaging tests, ultrasound tests, genetic testing, all these just to check the structures of the reproductive system and also other parts of the body if there are problems. So if you're just joining us, we're talking on male factor infertility. So just before we get into the treatment and possible consideration, so do well to like, subscribe, and share this video to somebody who may want to see. Don't forget to follow us on all our other social media platforms. Follow us on Instagram, TikTok, Facebook, and check the link in the description here. You'll find a WhatsApp channel or a WhatsApp link to a group. You can join that our personal WhatsApp group and we can interact with you. So what are the possible treatment options? Now, the treatment options will be dependent on possible causes. So if it's a structural cause, it may need surgery to unblock. If it's a genetic cause, it may need drugs, depending on what it is. So some of the treatment include lifestyle changes. So if it's caused by exposure to chemical, like maybe if you're smoking or alcohol, then maybe you need to cut it off. Sometimes if it's due to obesity, there's a need to maintain a healthy weight. If it's by toxins from the environment, you may need to change job, but it's possible. You may need to change job. So it's essential so all these just to improve the sperm quality or to improve the structure of the reproductive system. There are also medications that can be given, like hormone therapy for people that the issue is hormonal problem. So there's hormone therapy. Hormone therapy, it's essential. So it can be used to address hormonal imbalance or possibly other, that if it's the medication is hormone or maybe other drugs to address other underlying conditions if it was caused by disease. I've talked about surgery. Surgery is to correct structural problems, maybe like varicocele or blockages in the urethra or any part of or any of the tubes, vas deferens, the seminiferous tubules, and the rest of them. So surgery can be done to correct that. Then there is assisted reproductive technology (ART). Sometimes correction cannot be done, or sometimes the damage is too much based on prognosis. Procedure like IVF, that's in vitro fertilization, or maybe an intracytoplasmic sperm injection, can be used to help couples who already have fertility issues to get treatment and also to conceive, especially when other treatments are not possible. So, what are the things you should consider? You should consider the emotional impact. Now, this is especially to healthcare professionals. Infertility can be a source of stress and emotional distress for both the person and the couple or the family. So be very careful when you're communicating. Communicate with empathy. Look out for them. Talk to them with empathy. It's essential. Then use couple-based approach. It's essential that both couples are evaluated because infertility is a couple's cause. So both partners should be evaluated. Then there may be need for specialized care. So it has to be, there's a need for a specialized care, not something that anybody could take care of. Look for a specialist, maybe a fertility specialist or an andrologist that oversees male problem and focus this care on this person. And when you do this, it's essential that such a person will be able to undergo such care and that will go down for such a person. So that's what we have for you this afternoon. Thank you for joining us. And we hope that when you watch this, if you'll be watching the replay, that if you have any questions, send in the comment section. We'll be glad to answer your question. Follow us across our social media platform. Follow us on TikTok, follow us on Facebook, follow us on Instagram. Then check the description and join our WhatsApp group. I'm be glad to discuss with you. If you have any suggestion, any topic we should talk about, please send it across to us. We'll be glad to share and to discuss. My name is Nosa Kwalpan. I'm your host on the Intimate Matters podcast, and it's always my pleasure to come discuss with you as it pertains to your most intimate matters being your sexual and reproductive health. Until I come your way next time, please do well to keep your intimate matters safe and sound because your intimacy matters. This is goodbye for now. Thank you.